Joining us now is Dr. Robert Murphy, a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Morning.
I wonder, even if they put a warning label, I wonder if Americans are just too freaked out by this to deal with it. And I wonder if maybe the Johnson & Johnson is better served in places that are struggling to get vaccines around the world. What are your thoughts on J&J?
Well, let's wait and see what the ACIP, this is the advisory committee that's been looking at all the data worldwide for the last 10 days, and we're waiting. You have a good point, but remember, these side effects that we've heard are not distributed generally through the vaccine population. And this vaccine has a lot of good things going for it. You know, one shot, it's got less acute side effects than the other vaccines. The refrigeration requirements are less. You know, it's perfect for people, you know, that are locked up in their home. I mean, limited to their home, you know, home care. And so there's some good things about the vaccine. So let's wait and just see, because, you know, maybe with this warning label, people, especially women, you know, under 55 perhaps, are just not going to want to take it.
Dr. Murphy, let's talk about taking your mask off outside. The CDC is reconsidering that maybe we can take our masks off finally while we're outdoors. What are your thoughts on that?
Well, yeah, Anna, you bring up some really good points. There's some really, finally, there's some hard data to support this. According to a Journal of Infectious Diseases article, and this is a very highly respected medical infectious disease journal, you are 18.7 times more likely to get infected indoors than outdoors. And that of all the cases, only 10% are associated with being outdoors. So all that leads to, hey, if you're vaccinated, what do you need to be outside with a mask for? Right now, though, unfortunately, you know, we still only have about a quarter of the people fully vaccinated. About half have received one dose. You know, we're almost there. I prefer the recommendation of Dr. Jha, the dean of the School of Public Health of Brown University. He's saying, look, this thing, ultimately, we'll be like Australia. We're not going to have to wear masks maybe anywhere, except maybe in very closed, confined spaces. But it's going to go in steps, and we're just not really ready yet. But it's going to come soon.
Very quickly, LA was doing horribly, and now they're doing great. How did they turn things around there?
Very simple public health measures. Locking things down, closing up restaurants, closing up bars, enforcing masks use and social distancing, limiting gatherings. It works.
All right, let's get to viewer questions. Here's the first one. I have a face-to-face meeting with a client whose 6-year-old just got diagnosed with COVID. Both of us have completed shots. Am I okay to go?
Now, so this has changed recently, the recommendations in a situation like this, and that people who are fully vaccinated, who are exposed to a known COVID case, no longer have to quarantine. So technically, they can get together. Now, that mother with the sick child, she is at a slightly increased risk, but it's very slight. So, you know, they definitely should mask and socially distance, but they supposedly can meet according to the guidelines.
Okay. This is our second question. Realistically, when do you think we will be able to safely travel to Europe?
Well, they won't let us go there right now, so we don't have to worry about it right now or anything acutely. We're banned. You know, right now, you don't want to go to Europe. Most of the countries are still in lockdown. There's, like in France, there's a curfew at 7 p.m. Everything is closed. It's a disaster. Now, they've already predicted, and this is other countries too, that they will start loosening up in May and June. But there's no sign when they're going to let Americans in. We've got to get our infection rate under control. We're one of the highest level risk countries. So put it all together, I would estimate end of summer, early fall, that some kind of travel will be allowed into some of the European countries.
Perfect.
All right, here is the next question. I'm a breastfeeding mom and I'm scheduled to get my vaccine this weekend. Is it safe to breastfeed after vaccine? Can my baby get immunization reaction?
Yeah. Oh, so the latter part is great. So the baby, there's no risk to the baby. The baby's getting antibody. The baby doesn't get anything really from the vaccine. There's no formal recommendation here. However, the data, and we talked about it earlier this week, in the thousands of women that have been followed, not in a clinical study, but just followed, no apparent risk with pregnancy, breastfeeding, anything to do with the baby. The babies get antibodies that protects them, actually. So, the data look good, but it's still, unfortunately, no controlled clinical trials have been finished, so it's a personal decision between the obstetrician and the patient.
Okay, Ed, this is the next one. If I'm 2 weeks past my second dose of the Moderna vaccine and now fully vaccinated, is it safe to exercise for 20 to 30 minutes on a treadmill at my gym without my mask, as long as I'm in an area where there is no crowd and can easily keep at least 6 feet of distance?
Well, if there's nobody else there, yeah, you can go exercise by yourself. But at this particular point, the gyms are a high-risk place. Now, if the gym had a vaccine-only policy, that would lower the risk. It's not a guideline yet, but that would actually lower the risk. At this point, that's not happening. So I would say that you still have to wear a mask.
Do I still have to watch my husband wait for secondary effects from his second vaccine from Pfizer after 72 hours, or am I done watching if the other shoe will drop? Well, that's a personal question, Dr. Murphy.
Yeah.
It depends, how much you really like him.
Yeah. He's not a psychiatrist.
Fed up with this one. You push it off for weeks.
No, I still like him. I'll keep him around.
Okay.
But I'm watching him like a hawk. It's been 72 hours of waiting on him hand and foot. I'm done.
Yeah.
Done.
Hey, you marry a hypochondriac, those are the consequences.
You marry a man, that's what happens. If you have any questions for Dr. Murphy, thank you so much, dear doctor. You can head to our Morning News Facebook page and post it there. We'll talk to him again on Monday.
Thanks, doctor.
Paul?
Good weekend.